So, okay, going forward to the indications of the body temperature. Why do we need to take the body temperature? Okay, so as I said, number 3, it is to observe and monitor patients' changes in indicating in infection. The number 4 is to monitor the effect of treatment for antimicrobial therapy, which I already discussed with you. And the last one, before and during a blood transfusion, to monitor for signs of reaction. So why it is indicated during the time that there is a blood transfusion going on. So before and after, it is a basis whether during the time of blood transfusion, the patient is going to have a sign of blood transfusion reaction. Whether the patient is going to have fever, and automatically, once the patient got fever, so the doctor will order the stop of blood transfusion. So what are the measurement methods in taking the body temperature? Different methods used for measuring temperature produces different result. So what does it mean? So means to say, when we are taking in a different part or different site, means to say that the temperature reading depends if the part of the body is being measured, like for example, it is in the rectum or it is by the mouth. So the body temperature changes, okay? So the typical daytime temperature among healthy adults are as follows. So it is rectal and tympanic. It is rectal and tympanic temperature is about 37.5 degrees centigrade or 99.5 degrees Fahrenheit. So the oral temperature is about 36.8 degrees centigrade to 98.2 degrees Fahrenheit. And the axillary temperature is about 36.5 degrees centigrade to 97.7. Okay, so we know now with this different measurement. So depending on the time of the day, so we will know whether it is rectal, it is tympanic, it is oral or axillary. It varies. The temperature reading is different, but it is normal. Okay, so we need to know the normal temperature of its body measurement. The procedure for the oral method, which is taken orally in the mouth method can be used for children who are older than 5 years of age. It is also recommended for adult because in adult, you can instruct them if they can put it under the tongue and they can hold them. While in the children of 5 years and above, so you can just instruct them or you can just hold the tip for them to so that they are not going to they are not going to bite it. Okay, so the proper instruction is you need to let the children of 5 years and older so that they will know how to take care of it when you put their thermometer on their mouth. So it is not recommended actually for the children younger than 5 years of age, okay? So because it is hard for them to hold the temperature under their tongue for a longer time. Number one procedure for this one is you have to instruct the patient first that you are going to put the oral thermometer under their tongue. So secondly, you will instruct them to close their mouth. So you will leave the thermometer in place for about 1 minute or until you will hear the beep. And thirdly, you have to remove the thermometer once the beep sounds and read the temperature reading. Record the temperature result after. So this is in the oral method or the oral temperature taken by mouth. So while we are going to do our practical or the actual, we are going to make this step. Okay, so I will show it to you first, and the next, you have to do it. You have to do the return demonstration. Means to say, you have to do it in front of me. So I will know whether you are doing it correctly and you are doing it in a proper way. Okay? So by this kind of thing now that we are talking about, there is a theory that we are talking in the classroom. So during this time, I just want you to know, or I just want you with your imagination, just imagine how you are going to do it in an actual way. Number two, the tympanic method or the thermometer taken by the ear. So the ear method is recommended for children older than 2 years old. So why older than 2 years old? Because at least these babies, they are moving. So if you're going to use the digital one, either they might break it or they might bite it. So this is the quickest to use, and the ear method can produce temperature readings that are incorrect sometimes. So even when the manufacturer's directions are followed. So it is not mostly recommended. So when the doctor will just order you, it is for some isolated cases only, or if the doctor wants to do it only. Okay, so number two, you have to clean the probe. There is a probe tip or a probe cap. So this one, either you have to clean it or you have to change with a new one, disposable cap. So number three is you have to pull it gently. You have to pull the ear, a little gently, pulling it back so that it will help strengthen the ear canal and make it a clear path for the cup to get in. Okay, gently insert the thermometer cup or the thermometer itself until the ear canal is fully sealed off. You cannot just push it inside, deep inside. So there is only a limit. So once you be there, so it will stop automatically. So it will not go through. Number five is squeeze and hold the button for 1 second. So once you press it, and then it will beep again. There is a beep. You will hear the sound of the beep again, and that's the time you have to remove it and read the measurement, and record the thermometer reading. Okay, so that is the tympanic method taken by the ear. So we have the axillary method, which is taken by the under the armpit. So the armpit method is usually used to check the fever for newborns and young children. So by holding the thermometer tip, you will put it in the center of the armpit. For all of this measurement, you have to instruct first the patient. You have to explain what procedure you are going to do to the patient so that they will not be wondering or they will not be shocked. What are you going to do with them? So number three is to tuck your child's arm snugly closely against their body. So once you inserted the thermometer inside under the armpit, so you have to keep it snugly, close it together. So leave the thermometer there in place for about a minute and until you hear the beep. Remove the thermometer and read the temperature. So this is the axillary method under the armpit. Rectal method or the rectal thermometer, temperature taken by the rectum. So in the rectal method, it can be used to check for fevers in the newborns and the young children. Those babies and the young children, like for example, around 1 to 3 years old or 1 to 3 months, you can use the rectal thermometer. Or for those patients, adult patients who are already bedridden, who are already unconscious. So you can take the temperature rectally. So as I said, the first step for all this measurement, you have to hand sanitize your hand or hand wash, or at least to clean your hands. And then instruct the patients or explain the procedure to the patients. Number 3, cover in this rectal thermometer, you have to cover the tip of that rectal thermometer with petroleum jelly or the KY jelly or the Vaseline. Okay, so because you cannot insert it to the rectum without the lubricant. Lubricant means we are calling the petroleum jelly or the Vaseline. So it helps to keep that inside smoothly and easily. So gently insert the thermometer. No. So place your baby or place the adult on their back with their knees bent. That is for the baby. But for the adult, you have to put them in the position like on the lateral side with their one knee bent over the extended leg. Gently insert the thermometer in the rectum about 2.5 centimeter or about an inch, holding it in place with your fingers. So once you inserted the tip of that rectal thermometer, you have to hold, okay? You have to pinch the fold of the skin so that it will not come out. So leave the thermometer in place for about a minute until you hear the beep, and remove the thermometer, read the thermometer, record the thermometer reading, and clean your thermometer tip or the rectal thermometer. Okay? So whatever I have given you as per the steps, you just put it in your mind to imagine that we are doing it right now. So in practical, in the actual that we are going to do it, so it stays in your mind that this is going to be what we are going to do in an actual. Number four is by the skin on the forehead over temporal artery. So this, you are seeing it most often nowadays because this is the most common that we are using for the COVID screening. So we are just disinfecting the thermometer scanner and just put it on the forehead, and you will be able to take the temperature. So it is with the scanner and with a small window. There is a display window that you will find the reading of the thermometer. Record the thermometer and the time it was done. So next we have from the body temperature, we move forward to the pulse rate. All of this, we are taking it, measuring it in 1 minute time. Okay? So all of the body temperature, we are measuring it for 1 minute. So we are going to the pulse rate. What is a pulse rate? Okay, for all of you who are new to this, pulse rate is the measurement of the heart rate or the number of heartbeats per minute. So we are talking about measuring all of this within 1 minute. As the heart pushes blood through the arteries and the arteries expand and contract with the flow of blood. So the resting pulse rate for an average adult is between 60 and 80 beats per minute. But the others, in some other book or some other references, the pulse rate is between 60 to 100 beats per minute. So we will just take it as in 60, the normal heart rate or the normal pulse rate is 60 to 100 per minute. So taking a pulse not only measures the heart rate, but it also indicates the following. So if we are taking the pulse rate measurement, so we are taking the heart rhythm, the sound, there is a rhythm of the heart. So you will feel the heart rhythm and the strength of the pulse, how strong it is. So when you are taking the pulse rate, you have to check the strong sound or the bounding. Okay, yung tumitibok-tibok. So the pulse is a bulge of an artery from waves of blood that course through the blood vessel each time the heart beats. Okay, so the pulse is often taken at the wrist to estimate the heart rate. This is the most common. Okay, the pulse rate is the most common that the doctor is going to order you. Take the pulse rate. So whenever the doctor will ask you to take the pulse rate, there is a site for you to take. Okay, so we will learn about taking off where are the sites of the pulse. In the pulse rate, the normal pulse rate for healthy adults ranges from 60 to 100 per minute. So as I mentioned before, there are some references that says the normal pulse rate is 60 to 80. But some other references, they gave us the measurement of 60 to 100 beats per minute. So the pulse rate, it may fluctuate, it may varies, it increases when you are doing your exercise, when you are sick, when you are injured, when you have your emotions, like when you are lonely, you are sad, when you are happy. So this pulse rate fluctuates. It comes in different numbers. So females aged 12 and older, in general, it tends to have faster heart rates than the males. Okay? So athletes, remember this, that the athlete, such as runners, who do a lot of cardiovascular exercises or conditioning, they have the heart rate near 40 beats per minute. Why? And this is no problem. Why? Because for those athletes, their heart is conditioned. And with the 40 beats per minute, it is normal for them. So you must not be alarmed when you are taking a measurement of a pulse for an athlete patient. So during the time, you will be shocked why it is 40. So below 60, it must be alarming. But with those patients who are athletes or the people who are athletes, they have the normal pulse rate of 40 per minute. So what is the difference now between the heart rate and the pulse rate? So we have to differentiate what is in the heart rate and with the pulse rate. So it is said that the heart rate is the number of times the heart beats in the space of a minute. So means to say they are the same, right? So the heart rate is the number of times the heart beats in the space of a minute. So the pulse rate is exactly equal to the heartbeat. So as the contractions of the heart, it causes the contractions of the heart causes the increase in the blood pressure, in the arteries that leads to a noticeable pulse. Okay now? So we knew that the differentiation between the two, there is nothing to compare, since the heart rate is the same as the number of times the heart beats. Okay? So the conclusion now in the differentiation between the heart rate and the pulse rate is taking the pulse is therefore a direct measure of the heart rate. So now we come to know at the end of this pulse rate and heartbeat, so means to say heart rate and the pulse rate is the same. It is the direct measure of the heart rate. Okay? So what you will get with the pulse rate is the same number, is the same beat that you will get with your heartbeat, heart rate. Okay? So now, we need to know when we are going to take the pulse, there are pulse points. So the pulse may be palpated in any place that allows an artery to be compressed near the surface of the body. So there are about 9 points, 9 pulse points. Where are they? So they are located from the carotid artery, number 1. It is the pulse at the neck. So we have number 2, we have the brachial artery. You will feel it inside of the elbow. Doon sa inyong ibabaw ng elbow. Okay? Radial artery is at the wrist. Okay? This is the most common pulse rate that the doctor is asking you to take. Radial artery. Femoral artery is palpated. You can feel it at the groin, sa singit. Okay? Popliteal artery is behind the knee, sa alak-alakan. So posterior tibial is near the ankle joint. Dorsalis pedis, it is the artery on the foot. Temporal artery is on your forehead. On the side, this is the temporal. You can feel it whenever you have headache. Okay? So this is the temporal. Apical is not a pulse, but you will only hear it with the use of stethoscope. You cannot hear the apical artery by the use of the hand or the fingers. It can only be used by listening through the use of stethoscope. Got the point? There are 9 pulse points. You have to remember that. There are 9 pulse points. And in these pulse points, you will ask by the nurse or by the doctor to take it in these places, in these sites. Okay? There are 9. Carotid, brachial, radial, femoral, popliteal, dorsalis, temporal, and apical. So we have to know where are those pulse locations are. So these are the 9 pulse sites. So starting from the head, you will find your temporal. Okay? So you follow according to this, so you will not miss anything. Okay? So if you will remember like the pulse sites, I will go first with my head. So head in the forehead, the temporal on the side, that is the temporal. Okay? You can feel it. You can you can use your 2 fingers, your middle and the index finger or the pointer finger to take the pulses. These are the only 2 fingers to use while taking the pulse. Okay? The pointer and the middle finger. Only 2. Okay, so now we have the temporal. Feel the pulse on the temporal. You can feel your pulse there. Whenever you are having a headache, so you can feel that it is bulging. There is a pulse. Okay? Did you experience that? Okay, so that is the temporal. Going down to the carotid. Carotid is between your jawline and your neck, in the middle. So alam nyo to, pagka kinakarate yung mga tao dito sila pinapatay. Okay? So this is the most deadliest. Itong carotid. This is the most deadliest artery. The carotid artery. That's why all those karate blah blah. This is the pulse, the artery that they are targeting. Okay? So carotid artery. So whenever there is a patient going to die, the doctor is taking the pulse on the carotid. So it is because this is the most critical, the most crucial. Going down, we have the apical. Apical, you will feel it in between your sternum. You know, you cannot feel the heart itself because it covered by the sternum, the bone. So under the bone, in the like the V shape, you will find 2 inches below. That is your apical bit, the tip of the heart. So you will use the stethoscope to check the apical beat or the heart rate. Okay? So going down, we have the radial. Radial is in the hands. On the when you open your palm up, so you will feel the radial pulse here. Okay? So this is the most common pulse that we are taking. So when the doctor asks you, take the pulse of the patient, normally they are not telling you, take the radial pulse. So you have to take the radial pulse of the patient. Okay? So without telling anything, when the doctor asks you to take the pulse of the patient, take the radial pulse. That's the most common pulse site. Going down, we have the brachial pulse. Brachial pulse is at the back of, what is this? The forearm. So this is the place, brachial artery or the brachial pulse is the place or the site where we are taking our blood pressure. Okay, for the radial, we are taking it as common. It is the most commonly taken pulse rate. And for the brachial, brachial is being used for taking the blood pressure. Going down, we have the femoral. The femoral is being used by the doctors of the heart. The cardiologists, they are checking your femoral pulse dun sa singit. Going down below, sa likod ng alak-alakan or at the back of the knee, there is the popliteal pulse. This is the least. Nobody is taking the popliteal pulse. We are just showing where is the pulse in the knee. Okay, the back of the knee. And going down, we have the dorsalis fidelis. Dorsalis fidelis is on the top of the foot. Okay, so you can feel the pulse on dorsalis fidelis. And there is the last one. We have the posterior tibia. The posterior tibial pulse is on the side of the ankle. Okay, so these are the 9 pulse sites or the 9 pulse points. Number 1, how to or the procedure measuring pulse rate in the carotid artery. So the common carotid artery is palpated, as I told you, with use of the middle finger and the index finger only. So use this, palpate or locate the pulse between the neck and the jaw, between the jawline and the larynx. Okay, so you will know where is your carotid artery. The brachial artery pulse is palpated in the aspect of the elbow as I told you, where we are using this with the stethoscope to take the blood pressure. Radial artery pulse is the most common. So it is the common side. It is on the anatomical stop box. So the same way, you have to press the pulse and counting it between 1 to 1 minute. You have to count it, and whatever you will measure is your radial artery pulse in 1 minute. So the same way with the femoral pulse, you have to palpate it between the thigh and the pubic symphysis. So it is in your seeing it. Popliteal pulse palpated on the posterior knee, sa likuran, sa alak-alakan. It is the most difficult, and it is it is the least. So nobody is taking this popliteal pulse. Posterior tibial pulse is the pulse palpated posteriorly on the tibial artery underlying the bone, middle and index fingers to use. Dorsalis pedis pulse, it is palpated in the groove. Okay, so it is, the dorsalis pedis pulse is palpated in the groove between the first and the second toes. Yun dun sa ibabaw ng inyong paa. Temporal pulse is taken dito sa ating temporal, and the apical pulse is an apical pulse, but it is apical artery. So it is located, as I told you, in the middle, between the bones of this sternum and 2 inches below the sternum bone. Okay, when taking the pulse rate, as in common with the pulse in the radial pulse, you have to turn one hand over so it is in the palm side. This is the picture of how to take the radial pulse rate. Okay, so we will be discussing how to take it. You will just put your 2 fingers, the middle and the index finger, 1 inch below the wrist. Okay, so you will feel your pulse rate. Can you feel it? Okay, by using 2 hands only. Never use your thumb. Okay, especially when you are taking others' pulse rate, because you will be hearing your pulse rate, not your patient's pulse. So don't use your thumb. Only use the middle and the index finger. So going back, turn one hand over so it is the palm side up, as we have seen in the photo. Use the other hand to place 2 fingers on the wrist, and then when the position is right, when you already feel the pulse rate, you should feel the pulsation of the heartbeat too. This is the same, right? Pulse rate and heartbeat is the same. So once you feel the heart rate, the pulse rate, you are feeling the heartbeat too. So use a timepiece or a watch with a second hand. So never use the digital watch in taking any pulse rate. So use the watch with a second hand. Okay? So to look for that, because this is what we are going to use to count in 1 minute. When you already feel the pulse, when you felt it, you have to begin counting the pulse when the clock second is on the 12. This is for you to start with, because it will be difficult to take the pulse because this is your first time. Okay, so we will be counting the pulse when the clock second hand is on the 12. It will be easy for you to learn first, as you are the first timer. But later on, it will be easy for you. You will be counting it in 15 seconds. Multiply it by 4, equivalent to 1 minute. Or you want it to count in 30 seconds. That is multiplied by 2 and you got a 1 minute pulse. Okay, but for you as the starter, as you are new to this pulse taking measurement, you have to go counting from starting of the second hand on the 12. Okay, so once you will count, you felt the pulse and the second hand is on the 12, start counting the pulse. 1, 2, 3. You can feel it. You try to feel your pulse now. Okay? Once you feel your pulse, it is rapid. It depends. Okay? So if it is on the middle, okay, now it's going to be in the quarter. So the second hand is in the quarter now, right? So if it is in the quarter, the full 1 minute, the next last number that you will count is on the same full minute. You got me? That is the 60 seconds, 1 minute. But if you are already expert, so because nowadays you are in a hurry and you have so much of things to do, so you don't need to count 1 minute full. So you need to count in 15 seconds. Okay? So that is the trick. It is not my trick, but it is also taught in the references and in the international standard of the reference. Okay? Because nurses nowadays or the doctors or the nursing aide, they are so much busy. So you cannot wait for 1 minute to wait for the pulse to be counted. So what you need to do is count it in 15 seconds, but multiply it by 4 and it will come 1 minute. Like for example, you count in 10. You count it in 15 seconds. Multiply it by 4. How much it will be total? 10 into 4.
40.
40. Okay? So that means to say, you count is the same as counting in 1 minute. So you counted it only in 15 seconds. So if you are counting in 30 seconds, like 10 in 30 seconds, so how much it will be total? So it will be 20, right? Okay. So this is how it is. This is how you're going to do it once you are competent enough. Once you are already knowing the process of counting. Okay, don't forget that. So in 15 seconds times 4 and in 30 seconds multiply by 2. Double it. Okay? So the pulse rate should be between 60 to 100 beats per minute. So the record, the vital signs chart,